Hey girl, I'm gonna tell you exactly what I do as a virtual nurse. So as a virtual nurse, I'm responsible for supporting the bedside nurse by doing their admissions, their discharges, and their rounds. I get assigned to a hospital and then I get assigned to a unit. And depending on how many virtual nurses are working the unit with me, I can have 24 patients, 18 patients, 10 patients. It just depends. So the way I interact with the patients is I call in through the TV in their room. I'll be like, hey, it's a virtual nurse. It's okay to turn my camera on. And then they'll say, yep. And then I'll turn it on and we'll start talking. With that being said, that's exactly how I do all of my admissions, all my discharges, and all my rounds. So for admissions, the bedside nurse will call me and she'll be like, hey, can you do this admission in room so-and-so? And I'll be like, yeah. And I'll go in there, ask the patient, can turn the camera on. Then if you've ever done an admission in a hospital, you know, you're just asking them a whole bunch of questions. You ask them things like, what's their past medical history? What medication were they taking before they were admitted to the hospital? And if they received any vaccines, things like that. The bedside nurse will call me again to do discharges. She'll be like, hey, I've got a discharge in room so-and-so. Then I'll go in there, ask to turn my camera on, and I'll go over the AVS with the patient. If you've ever worked in a hospital, you know AVS is an after-visit summary. I'll go through that because that has all their follow-up appointment, their medications, their discharging diagnosis, things like that. I'll go over all that. I'll do all the education, all the teaching. And once I finish the discharge, I just let the bedside nurse know. Then I do rounds. So if you've ever worked in a hospital, you know falls is a big issue. So I round and I do safety checks, making sure the falls bundle is initiated, things like that. I also do teaching. At the hospital I'm assigned right now, CHF and COPD, readmission rates are really high. So to combat that, I do all the education for patients who have CHF and COPD. So I also do that while I'm rounding. I also do a pain assessment, and I'll answer any questions the patient has about their care because I can see all their vital signs or doctors know. Like I have access to Epic so I can see everything that the bedside nurse can see. And lastly, I can sign off on drips. So the cameras are in patients' rooms. If the nurse needs to sign off, I can use that camera to sign off on blood, insulin, any cardiac drip the patient might be on. Again, this is another way to help the bedside nurse, because sometimes nurses aren't always available to sign off on something. But if you got a virtual nurse, you just call them like, hey, can you sign off this blood with me in room so-and-so? And then I'll call in using the patient's camera on their TV, and we'll sign off, which I think is pretty cool. So that's exactly what I do as a virtual nurse.